Hello, welcome to this episode of a YouTube video on ultrasound. On today's video, we are going to talk about blighted ovum or an embryonic pregnancy. Sometimes we call it failed pregnancy. So, blighted ovum is basically means when there is a large gestational sac in the uterus without a yolk sac or fetal pore, meaning the egg and the sperm has been fertilized each other. The sperm has been fertilized the egg, and then the gestational sac was formed, and that sac was implanted in the endometrial cavity of the uterus. But instead of that sac to develop a yolk sac or a fetal pore, the sac is continue growing. It's just a continue growing without a formation of yolk sac or fetal pore. And then on ultrasound scan, you will see it like this. Just you see a anechoic gestational sac, large anechoic gestational sac. It's just a sac in the endometrium with a fluid content inside the sac, but there is no yolk sac or fetal pore inside the gestational sac. And then this is formed as a result of chromosomal abnormality. Maybe the chromosomal abnormality was the result from the chromosomes of the sperm or chromosomes of the egg or ovum. So this is due to the chromosomal abnormality, and this blighted ovum is the number one cause of miscarriage in the first trimester. So whenever there is a large gestational sac without a yolk sac or fetal pore, and then if you measure the mean sac diameter, of the sac, it reaches about 20 to 25 millimeter. When you measure a gestational sac reached about 20 to 25 millimeter, any gestational sac that you measure its mean sac diameter and it reaches 20 to 25 millimeter without a yolk sac or fetal pore, that is the definition of blighted ovum. So blighted ovum can occur in some women, and then just as you are seeing here, you are seeing a large gestational sac in the endometrium, but if you zoom the sac and look at it very well, there's no any yolk sac or fetal pore present inside the sac. So this is ultrasound diagnosis of blighted ovum. And blighted ovum is not reversible. There is no any medication or any advice that you can give to a woman, maybe to make it to be a real pregnancy. The only way out is to flush it out using all this medication, misoprostol, mifepristone, or mifepac, those abortions medical fields, to terminate it, because you cannot reverse it, you cannot correct it. So this is ultrasound diagnosis of blighted ovum. And sometimes you can see a gestational sac with a yolk sac, but the sac is irregular, meaning the wall outline, the outline of the sac is irregular and is large or elongated. It may be possible to see a yolk sac, but the sac, the things is a blighted ovum, because seeing a yolk sac does not guarantee you that things is a real gestational sac, because you can see it was a yolk sac, and then you see it was irregular wall, and you see it is very large or maybe elongated. So this is a blighted ovum. This video I'm going to post it in my YouTube channel so that anyone can go there and watch. And then if you have any question regarding the blighted ovum, you can quickly ask, so that we are going to respond to you with the appropriate answer.